Another important question consumers want to answer in shopping for health insurance is whether their medicines are covered and at what cost to them. Let's look at the lowest premium silver plan from the first insurer to see what we need to do to find out what medicines are covered. Again, each plan has a direct link to find the list of covered medicines, which is very helpful to consumers. For the first plan, we go straight to a search engine that allows us to search by brand name or generic name for each medicine, to look at the list alphabetically or by therapeutic class. Let's take a look at the list by therapeutic class. The names are not consumer friendly. For example, a consumer would need to know to look under antihyperglycemics for diabetes medicines and antineoplastics for cancer medicines. The drug list also has a column labeled status, which relates to the consumer's out-of-pocket costs. Those labels include naming a tier, numbers 1 through 5, and other labels, such as specialty medicines. At the bottom of the list, these terms are described. A consumer has to go back to the plan and select the plan summary document to see what those labels actually mean in terms of out-of-pocket costs for the consumer. In the plan summary document for this plan, different terms are used than were used in the list of covered medicines, making those comparisons difficult for consumers. For example, there's only one reference to a tier level in the plan summary in terms of out-of-pocket costs, although the covered drug list included many tiers. The use of different terms presents challenges to consumers trying to estimate their out-of-pocket costs for medicines under this plan. Next, we look for the list of covered medicines from the lowest premium silver plan from another insurer. The link for the list of covered medicines under this health plan opens up a document of the drug formulary. The list is organized by tier number, which refers to the consumer's out-of-pocket costs, as described upfront in the document. Within each tier, the covered medicines are listed in alphabetical order. An individual would need to look under each tier to see if their specific medicine is covered. These documents are searchable, but a consumer would need to know how to enable and use the find command within the document to use the search. This document does not include those instructions. To learn more about what the tiers mean in terms of specific out-of-pocket costs, the consumer needs to go back to the health plan description and select the plan summary. Doing that takes the consumer to a page with 3 different options. Which document to select appears to vary depending on when coverage starts for the consumer. It's confusing to determine which one to select, and the fact that there are 3 different documents implies that they are different and that choice is important. To open the document, the consumer needs to pick one of the icons under the Actions column. We chose the document for coverage starting January 1st. In the document, the co-payments and co-insurance for medicines are described in terms of tiers, which matches with the covered medicines list. Using the same terms makes that comparison easier for consumers. What may not be obvious to consumers is that both insurers use one list for covered medicines. You cannot buy into a more generous list of medicines by selecting a gold plan over a silver or bronze plan. from these insurers. You will lower what you pay for medicines, but each insurer has just the one list.